Hi everyone, I'm João Alessi, medical oncologist from Hospital Sírio-Libanês in São Paulo, Brazil. And it's an honor to be here alongside my dear friend Alessandro Di Federico from Bologna. And we are very, very excited to be here at ASCO 2025. We have a very nice results from outstanding papers and presentations. So let me start. I would like to ask my dear friend here, Alessandro, about what he think about the results of Delphi 304, looking to the Tarlatamab for patients with in second line small cell lung cancer. Please.
Yeah, I think these results are outstanding. They for sure are practice changing for this population that is characterized by poor prognosis, especially in second line treatment. So this study really provides impressive results in terms of, especially overall survivals in a median OS of more than 13 months, which is probably even more than the OS that we see in the first line. So very, very impressive results. And also in terms of objective response rate and with MPFS, it was all consistent with a high efficacy of this new drug. And that's of course a great opportunity for patients with small cell lung cancer.
Yeah, I'm very surprised about the results. I mean, I'm very satisfied. It's something that these patients, small cell lung cancer, it's a very need for new therapies. And after, for instance, we have a durvalumab as a consolidation after chemoradiation in limited staging with improved overall survival. Now we have another piece that can improve outcomes in patients with extensive small cell lung cancer. So very satisfied.
Yes. Another study that I think was very nice to observe. It was a very nice abstract here at ASCO. It's a study investigating Sacituzumab tirumotecan for patients with EGFR-mutant non-small cell lung cancer will progress to an EGFR tyrosine kinase inhibitors first line, and then will progress also after chemotherapy as second line, the OptiTrop-03 trial. That's interesting because it's a setting where the standard of care is represented by docetaxel, which we know is not as effective as we would like to, and also a bit toxic as a monochemotherapy. So I think these results were very, very promising. We've seen results in objective response rate, higher objective response rate, PFS and OS. What do you think about this?
I think it's another good news for our patients. It's, as you mentioned, is a unmet need for most cases that had a progression after TKIs and platinum doublet. So in this setting, this scenario that we have a few options, this Sacituzumab has achieved a very, very nice response rate, greater, almost 50%, and a PFS that almost achieved 7 months. So I think it's could be a very nice option in the future, along with other TROP2 that are coming from other studies, as Datopotamab deruxtecan, having the same target that's TROP2. So next to the future, I think that's going to be very likely second, third line after chemo and TKIs.
Yeah, and I think also updates of previous studies have been presented, and maybe very interesting too and very important. I was thinking about the updated results of the CheckMate 816, which is the trial that tested as a neoadjuvant therapy, chemo-immunotherapy with nivolumab, so nivolumab plus chemotherapy for patients with resectable non-small cell lung cancer. What do you think about the updated?
Yes, very nice. You are a great scientist in this field. Just published a meta-analysis looking to the neoadjuvant versus perioperative setting for these operable cases. So I think it's reassuring that for most of our patients, giving only chemo plus nivolumab in the neoadjuvant setting, it's a good option. I would say that the best surrogate that we have here for sure is PCR. The data of overall survival at 5 years among those that achieve PCR is 95%. That's outstanding. And if you see the cases with PD-L1 positive and PCR, all of those cases are alive at 5 years. So it's going to be a good question to how we're going to choose our patients to receive neoadjuvant or perioperative. But I'm very happy to see these reassuring results, especially among those with PCR. Yeah.
Yes, I think biomarkers like PD-1 expression that is confirmed to have an important role also in the neoadjuvant setting. It's taken into account when considering escalation or de-escalation strategies for patients with resectable non-small cell lung cancer.
Yeah. Another update on this trial is among those that have a clearance of ctDNA just after the surgery. Those that were positive and then turned negative, they have a very good overall survival as well. So around 76%. So it's another biomarker that we can use in the next future. Yeah.
Another trial that I think was very interesting was the ALNEO trial. The ALNEO trial is the result of Italian cooperative group, oncology cooperative group called GOIRC, which involves several Italian institutions to enroll a rare population of patients with non-small cell lung cancer, that is those that harbor rearrangement in the ALK gene and have resectable stage 3 disease. So not so easy to find this patient and to enroll this patient. And this trial was a phase 2 trial, was presented yesterday by Professor Marcello Tiseo. And the results were I think also a bit surprising, because we were not expecting these good results for an oncogene-addicted population, since we had some not so satisfying results with other populations. I'm thinking about EGFR-mutant non-small cell lung cancer. What do you think about it?
I think the first is a huge effort to gather cases that are rare in the real life. I mean, stage 3 harboring ALK-rearrangement. So it's a very good congrats for the Italian team. So the results of a major pathological response that achieve almost 50%, it's something very, very nice for our patients. And aside of this, we have 12% of patients with complete pathological response. It's something that for oncoaddictive cases, we wouldn't expect with target therapies, as you mentioned about the new ADORA study that didn't achieve even closer this data. So I think some questions are still open. I would like to see more about the feasibility of surgery for these cases. As we know, for the immunotherapy-based neoadjuvant treatment, we have a kind of some difficulties in the surgery approach. So it would be very nice to see if it's something similar or not in the target therapy. It's something that we hope to see very soon.
Yes, there are a lot of open questions, like the number of cycles, the duration of treatment before surgery, for instance. It was 2 cycles, so 2 months in this trial. The duration of the adjuvant phase, that in this case was the same as the ALNEO trial, but I think this trial is proving that not all oncogenes are the same, not oncogene-addicted non-small cell lung cancers are the same. So we shouldn't give up if we see negative results with an oncogene. That doesn't mean that they reflect the entire oncogene-addicted population. So I think it's an important concept that this trial has proven, and hopefully it will be extended to other oncogene-driven non-small cell lung cancer population.
Perfect. And an excellent drug with a good tolerance. So I think it's something that can come to for our patients in the next future. Yeah.